Welcome my dear to this your channel, Clinical Consultant. This time I come to talk about a topic very little touched by other channels called human babesiosis. Well, without more to say, let's continue with the video. Concept: human babesiosis is a tick-borne disease, produced in animals by an intraerythrocytic parasitic protozoan of the genus Babesia. Humans are infected incidentally and suffer from a non-specific febrile illness. Epidemiology and demography. The incidence in the United States is unknown. It prevailed. In endemic areas, serological positivity ranges from 9% in Rhode Island to 21% in Connecticut. The maximum number of reported cases has occurred in New York. The predominance by sex is in males, possibly due to the greater exposure to the vectors in their recreational or professional activity. The severity of the age distribution seems to increase after 40 years. Peak incidence between spring and summer from May to September. Genetics none known. Congenital infection. At least one case of probable vertical transmission of neonatal infection has been described and at least 2 cases of perinatal infection have been reported. Signs and symptoms. In the incubation period of 1 to 4 weeks or 6 to 9 weeks in the secondary variant, a transfusion, gradual onset of irregular fever, chills, sweating, headache, myalgia, arthralgia, fatigue and dark urine. On physical examination, we can find milder frankohepatosplenomegaly, pedochy, and jaundice. Babesia avergens infection produces a more severe disease with more rapid onset symptoms and progressive parasitemia leading to massive intravascular hemolysis and renal failure. Etiology. Vector. The reindeer tick, Ixodes scapularis, also called Ixodes damani. It feeds on rodents during the spring and summer while it is going through the larval and nymph stages, and when it is adult it is fed by reindeer. During the warm months in an endemic area, humans are easily infected while participating in activities outside the home. Babesia microti, Babesia divergens, and Babesia bovis are responsible for most human infections in the United States. Cases of Babesia microti infection acquired from the northeast coast such as Nantucket Island, Cape or Martha's Vineyard in Massachusetts, Blog Island of Rhode Island, Long Island, Shelter Island in New York, as well as the continent near Connecticut and New Jersey. Sporadic cases have been described in California, Georgia, Maryland, Minnesota, Virginia, Wisconsin, and more recently by the WA1 strain in Washington state and the MO1 strain in Missouri. Babesia avergens and Babesia bovis cause human disease in Europe, where the disease remains rare, and is primarily related to asplenia. Most of the cases are symptomatic, and can be transmitted through platelet or erythrocyte transfusions. Mixed infections between Babesia microti and Borrelia burgdorferi are estimated to be 10% in Rhode Island and Connecticut to 60% in New York of all cases. Differential diagnosis: amoebiasis, ehrlichiosis, liver abscesses, leptospirosis, malaria, salmonellosis including typhoid fever, acute viral hepatitis, hemorrhagic fevers. Lab tests. A complete blood count shows mild to moderate pancytopenia, alterations in serum biochemistry, with increased creatinine. Liver function tests, lactate dehydrogenases and direct and total bilirubin. The urine analysis shows proteinuria and hemoglobinuria. Giemsby right stained thick and thin peripheral blood smear studies to detect parasites within the erythrocyte. There is a classic, although rare, form in which it forms tetrads or Maltese crosses composed of 4 daughter cells joined by fragments of cytoplasm. It is more frequent to find small forms with a single point of chromatin located eccentrically within a bluish cytoplasm. 2 parasitic erythrocytes can be multiply infected, but are not enlarged, and may show evidence of pigments as seen in infection with Plasmodium spp. Diagnosis is made by indirect immunofluorescence, (IF), serology specific for Babesia microti. A titer equal to or greater than 1:64 indicates seropositivity, while a titer of 1:256 or greater will indicate a diagnosis of acute infection. These tests are limited by the inability to distinguish between exposed or acutely infected patients. Indirect immunofluorescent antibodies of the IM type can be very sensitive and specific for this diagnosis. The polymerase chain reaction with Babesia DNA is just as sensitive and specific as the microscopic analysis of a thin blood smear. Non-pharmacological treatment gives support with adequate hydration. Acute treatment: in patients with normal spleen, they are usually asymptomatic, and when they have symptoms it is self-limited. Treatment is reserved for seriously ill patients, especially those who are asplenic or immunosuppressed. The combination of quinine sulfate 650 mg orally, every 8 hours plus clindamycin 600 mg, every 8 hours, 1.2 grams parenterally every 12 hours, for 7 to 10 days is effective but cannot eliminate parasites. The combination of adovacone 750 mg every 12 hours and erythromycin 500 mg per day 1 and 250 mg daily for 7 more days appears to be more effective than quinine plus clindamycin and is associated with fewer adverse reactions. After the exchange transitions, in addition to antibiotic treatment, it is an adequate treatment for a serious infection in asplenic patients and with an elevated parasitemia due to Babesia microti and Babesia divergens. Prognosis and medical referral. Prognosis: it is generally good and deaths are rare. Referral: early consultation with specialists in infectious diseases if the diagnosis is acutely suspected, especially in asplenic, elderly or immunosuppressed patients. Hospitalization in serious patients who need an exchange transfusion, in addition to antibiotic therapy. Important consideration is: the prevention of babesiosis in immunosuppressed patients is carried out avoiding the regions in which the vector is endemic, especially between May and September. If it is not possible to avoid going to or living in endemic areas, patients can be asked to have inspections of their skin every day in search of ticks, wearing bright clothes to be able to more easily visualize the presence of ticks, and applying repellent against ticks such as asleep or awake side in clothes or on the skin. Recommend infection of the apparent Fakar ticks in dogs and cats. Divergens: Babesia infection is frequently the most deadly of all Babesia species, especially in clinical patients. At least one case of Babesiosis and simultaneous of Babesia and Lyme disease has been described. To successfully treat birds in the 3rd trimester of pregnancy without adverse effects on the baby. Thank you for watching the video. Next video it will be colorectal cancer. Do not forget to subscribe to the channel and like the video and comment. Until next time, my dear clinical consultants, goodbye.